Hi, everyone. This is Kimberly Miller, your holistic health expert, and we are here with a new episode of the Healing with Excellence podcast. And joining me again is registered nurse Jess Smith. She's also certified as a Healing with Excellence practitioner and a neuromuscular restoration specialist. Today, we're joining to explain why she decided to take these programs because, when I created these courses, I was trying to create to show people how I healed myself and how to help other professionals learn how to improve patient outcomes, but also to teach everyday people how to heal themselves and that there were answers, kind of starting from the ground up, as Jess would refer to creating a strategy, a methodical approach. But sometimes it's hard to express how valuable these courses are because I'm not using some major marketing firm and it's not a university and it's different. A certification is different than a degree or a license. But I wanted to chat with her today about how much these courses have impacted her life and what inspired her to do it, so that hopefully it could help you guys see how this might add value to your life, either your personal life, your family, or your career. Because again, for me, this is knowledge that should be in everybody's hands. And, in Jess's course, there was a 45-year practicing nurse practitioner, and she could tell you the same thing. Like the stuff they learn in the course, they felt they should have learned in like their first years of med school. And there were so many aha moments reflecting back on patients that I feel like it's almost unethical or a crime to not have this information in everybody's hands. But I have to present it in a methodical way where I can't just give out pieces of it because then it doesn't make sense. So we have to do it in coursework so that you can really get the science behind it and know that no matter what your background, you can learn this stuff. So many people think that it's going to be over their head and they're not going to be good enough. And again, implementing it takes practice like anything new. But I pride myself in my gift or my goal is to take something complex, make it simple enough to learn how to implement it, and then help you through the process. And then again, encourage you when you feel like you're not doing perfect at things, because that's just how anything new is. Like when we first started writing, we couldn't write the alphabet. Then we couldn't write words. And then we got to where we could write a sentence, then a pair, and then you could write essays. But if we gave up the first time it was difficult to write an A and thought we could never do this, or the first time we fell down trying to walk as a baby, we wouldn't have the blessings of today. And that's the same thing when I teach anything new. But I wanted to get Jess's opinion on it and then like her value behind it to share it with each of you. So Jess, welcome to the show today.
Thank you. Thanks for having me. I'm very grateful to be able to participate in this with you.
Yeah, I so appreciate you. And we talked on the previous episode about you being a registered nurse since 2009, right? And then in the medical field prior to that, and then kind of transitioning during COVID out of being a case manager into becoming a holistic health professional. Not throwing away your previous knowledge, but looking at holistically, like where does medicine play a role and where does like learning how to treat your body as a temple play the role, right? So on the Healing with Excellence practitioner program, that's more where you do a thorough intake on someone's full history and you're looking at like, okay, what was the stressors that might have caused the issue? What is the goal the person wants to work on? And then you're looking at like vitamin deficiencies, their daily stressors, hormonal imbalances, and having a conversation as to where the puzzle pieces might be missing that is impacting the person from not getting the complete puzzle solved or not getting the best outcome. So when you decided to sign up for the Healing with Excellence practitioner course, what inspired you to do that? And what do you feel like was your biggest aha moments throughout that training online?
So, big inspiration, two things. One main catalyst was my own healing, which gave me hope that I could help tell other people how I healed. And I wanted in order for them to find their own healing. As I was healing, I was thinking, man, would have been nice to be able to tell so-and-so about this, or, you mentioned a patients coming to mind. Once I was actually gaining traction in my own healing, it was like, I need to tell people about this, because of my background with health and fitness, and I've always been interested in health and fitness. Probably more in a holistic way in my heart, but the tools that were available weren't really, they wouldn't make the cut. They weren't hitting all the bases.
Right.
So once I found something that did hit all the bases for me, and I got my healing going,
Mhm.
I was just like, I need to know more about this. So it was both find out more to keep myself, in I like to know the why, like tell me when I'm in the throes of pain or, trying to heal, just tell me what to do.
Right.
But once I have the capacity, I really want to know why did that work? Um,
Hmm.
and to move forward from a solid foundation. So it was both selfish for my own healing and my family's healing, but also how could I then help others with that. um Biggest aha moments, I'll say. There were plural. There were several. As you mentioned, going through the course with a fellow, she's a nurse practitioner, been doing it for a lot longer than I've been a nurse, but like the parallels were, it's like we'd look at each other and it's like, are you kidding me? The aha moments were, so there is something we can do about this, because we've
Hmm.
just been sending patients home on this pill or that pill, this band-aid or that band-aid, and just hoping that it'll work. Now, I want to say this. I am so grateful that modern medicine exists.
Hmm.
I am not shirking my career. I'm not saying that, it was a wrong move or that I should never become an RN. I absolutely am grateful so much that I did become a registered nurse, and that I worked in that environment. I did probably stay in that environment. I'm loyal to a fault, so I did probably stay in that environment a little bit longer than, like, it probably had run its course before I left. But ultimately, because of that experience, and because of my own personal experience, now I have those pieces to put together so that when I learn something, then I know I can provide hope for somebody, like, actually, I do think there's something that you could do.
Right.
So that was huge for me in the course. As far as AHA goes, there's actually something we can do for things.
Well, it's funny. I remember, well, two things. Well, I remember, I wanted to backtrack. I'll come back to that. But I remember when we went over the blood chemistry and like how you could log on to patient portal and figure out what was missing that might have created the ER visit. I remember you and Myra, like even having difficulty sleeping that night because nobody taught you in med school what the root cause were to the blood chemistry imbalances. And sometimes when you're in the ER, if like the ferritin's off or the lymphocytes are low or they're anemic, they're like, oh no, that's no big deal. Like we're taking blood labs for what? If we're not using them for, or if it's only off by 1 point, it's kind of brushed off. So you guys are like, Kim, we should have learned this the first year. And like that for me, when somebody told me I was incurable, and I just picked up on a few subtle things in my blood chemistry and then learned the root cause and then learned how to balance it, my symptoms went away. So what did you feel about, well, like when you learned about like the vitamin deficiency blood work and toxicity, and then the blood chemistry itself, like the general CMP and CBC panels?
I felt validated, actually, because I'm a question asker.
Mm-hmm.
I've been asking questions like, how come, okay, you say that doesn't really matter, but
Mm-hmm.
to whom? Because it seems like it matters to this patient whose symptoms are saying something. Like,
Mm-hmm.
I read the patient, not,
Right.
you treat the patient, not the monitor. You treat the patient, not the labs.
Right.
And I'm like, but they're acting like they're low. Well, they're only 1 point off. It can't be that. It has to be something else.
Right. Right.
And so it's very different how we looked at labs in hospital versus how we were learning about the labs with what you were saying. And again, the hospital setting is the hospital setting, right? And it's very much about, what's going on right now. Is it something that we can correct? Is it for right now? It's very much about the acute.
Yeah,
But even when these labs are being done in the follow-up appointments,
right.
they still take a very similar approach.
Mm-hmm.
So learning that, you can put something together and see that certain building blocks of the blood are off and
Mm-hmm.
recognize that that's related to a protein deficiency. It's
Yeah.
like, oh, that makes sense. Um,
Yes.
and another aspect in class, of course, is the nutrition question. Like, what are you eating? And these are things that I was going ahead and asking patients, like,
Mm-hmm.
what's your life like? Do you get up and drink coffee in the morning and then go all day, without eating? Like, do you
Right.
sleep at night or do you sleep during the day? These questions. So just so validating for me really was that my curiosity was for a reason. There's
Yeah.
a reason that I wasn't like satisfied with what I was being told to just don't worry about that, Jess. You ask way too many questions. They love me during
Yeah.
the pandemic.
Yeah, I bet they did love you, but that's why you messaged me in 2016 and I didn't see it on Facebook because
Yeah,
in the other
yeah.
category. But no, what I do want to say too, I want to piggyback on what you said as far as modern medicine. Many of you know that my daughter was recently in a head-on collision, and I can tell you without those surgeons and nurses, she would not be here today. So for me, we need modern medicine, but when there's like vague symptoms or chronic issue, sometimes modern medicine really isn't being taught how to identify the root cause and how to really help heal it, just to manage it. But of course, like if we need a surgeon or we need a nurse on staff to help that surgeon or to help in the patient care through their healing process, like this is just huge blessings that some people don't have access to. So 100% we need to have that. But just briefly doing just a quick recap on like something with blood chemistry. Like some people don't realize you could have just slightly low sodium and be hospitalized for bipolar manic attack just from low sodium. Or you might have low sodium and your heart rhythm is off and they're trying to do like shocking your heart or doing a heart cath, but not realizing that if you don't get the sodium right, the rhythm of the heart can't be correct. Or if someone's anemic, they might have severe edema or they might have a heart rhythm issue too, or tachycardia. If we don't learn and teach people how to reverse the anemia, it's going to be a reoccurring issue. You can watch their heart all you want, but until they fix the anemia, there's going to be some issue showing up in their body that has to be addressed. And I lived with anemia for 15 years. Like the hematologist couldn't tell me, my primary care, my gynecologist, the fertility specialist, nobody could tell me any of these things. And there's answers, as you know, to all of it. So the hospital might need to get you stable, but then we need to help, like, where is this root coming from? And then as a Healing with Excellence practitioner, walk the person through how to change it. Like literally, I reversed 15 years of anemia in like 3 months, and I've never had anemia again. And if I'm getting there, I know what I'm doing that's causing it. So what do you think about that? Like when there's just one minor thing off, or like, is there anything that you felt whether with labs or your muscle testing or anything that revealed things to your healing process that you did not learn about in medical school, in nursing school?
So many things. And you're right. We did during the course, it was definitely so much of the why are we not taught this? Why? And I was asking in school,
Yeah.
wait, why are we moving on so quickly from this? Like, isn't nutrition kind of like providing the body with the building blocks for life? I mean, I don't know, call me crazy. But
Yeah.
like, the nutrition book that we used was so old. It was so,
Mhm.
which in certain respects was not a bad thing, but they were like, well, pitch that, don't worry about that. And so then when we're talking in the practitioner course, it's like, oh, thank God, we're going to talk about nutrition, we're going to talk about the
Yeah.
food for people. But go ahead, go
Oh, no,
ahead.
you're good. Go ahead.
But yeah, those moments of clarity for you know answering those questions that are so they're obvious, but they're so subtle when you're looking through maybe not the wrong lens, but a different lens. So
Yes.
like somebody might be saying that there's something subtle off with them, or they can't pinpoint something. And then, with the labs that we run, or a test that we run, and we see, oh, there's something subtle off. Well, in the hospital, it just gets brushed aside.
Mhm.
It's not something that they dig any further on. But that's why looking at the whole picture and putting this piece with this one and this one, oh, now that says we've got, I don't know, estrogen dominance, or protein deficiency, or both.
Well, one of the things I was going through was lightheadedness and dizziness. Now, again, I'd been to multiple people. The hematologist ran my blood work, and it was an oncologist hematologist. And he said, "No, there's nothing." And I said, "Well, can I get a copy of my blood work?" I took the blood work, and my CO2 was off, my carbon dioxide. So I researched that. It was coming from my breathing pattern. I was in a fight or flight inverted breathing pattern, like a sympathetic overdrive. And that short, shallow breathing pattern was causing lightheadedness and dizziness. And then also, I did not know I had a B6 deficiency that I learned about in the micronutrient testing that we do. So it was like two simple things to fix something that I had been having for years. And I used to have like orthostatic hypotension, where you get lightheaded when you stand up, or they would say, "Gosh, your blood pressure is so low. How are you not like falling over?" And there was answers to all of that. It's actually not healthy to have an extremely slow heart rate. That means your body's slowly shutting down and can barely pump the heart because there's no energy. It's conserving energy. And it's also not good that when you stand up, you feel like you're going to fall over. And there's actually answers. It's either something going on in your neck or your diet or both. And you can look at that. Now, when I say diet and we talk about nutrition, I want to cover this because a lot of people say, "Oh, you're not a registered dietitian." You're exactly right. Some of you know I was in dietetic school years ago. That was my passion. And I was getting sick. And I learned that much of what I was learning was a lie. And then I had to leave that because I wasn't going to go to school 6 years to learn misinformation and then not be able to even like be healthy myself. I was diagnosed with chronic IBS. I had infertility, melasma, all this crazy stuff happening. And I thought I was eating healthy, and so many registered dietitians that come to me for their health, they're not taught about like anti-nutrients and how to test vitamin deficiencies and vitamin toxicities. And so what I had to do is study cell biology. I'm not a dietitian, I'm not a nutritionist, but I don't want to be because they're not taught how to heal, because the education is largely controlled by the pharmaceutical and the food industry. And if everybody gets well, you're not really going to make other people a lot of money. So when I started studying cell biology and seeing that the cells had to have nutrients to function and to carry out specialized functions like your thyroid, your blood pressure, your heart rate, I started saying, okay, well, what nutrients does the cells have to have? And so I started researching every essential nutrient required by the body, and then what food had that. So for me, I just created a general food list for myself that I was going to eat those foods every day to ensure the greatest return on investment of my calories and to reduce a loss in investment. So I didn't know some of the healthy foods were eating were anti-nutrients like phytates and goitrogens that were causing me to lose iron and zinc, and were actually delaying my healing process from like having too many grains, beans, spinach, avocado. And so I had to change my diet to match which foods had the greatest return and the least loss on investment. And that changed my life. So if we just teach people the science behind how much energy they need and the kind of foods it comes from, we don't have to write a diet plan. They can look at where the science is at and learn how to do that for themselves. I and you just personally hold people through that process, their hand through the process, because if this isn't your gift, like if you're excited about building motors or excited about painting or graphic design, you really don't want to have to be a food scientist or like track your food every day. So our job is just to kind of help make that a little bit simpler so somebody knows what their body needs. Just like you know what oil your car needs or what gas or how often to do your alignment, if you have your own body manual and your own body mechanic to help walk you through, like your health advocate, it makes things a lot easier. Like, did you feel that way through your process?
Absolutely. Yeah. Because all of the trying to figure everything out was
Mhm.
unbeknownst to me, but found out later in the course, it was burning off even more calories. And I
Right.
needed those calories and I needed that energy to heal.
Mhm.
So it's kind of like in the moment, it's like, okay, listen, we're just gonna walk each other through this, okay? And here's the information I have. if this, resonates with you, then we're going to work together. If it doesn't, it doesn't, not, and not everyone's ready, but walking through it together and saying, okay, this is what I know about the body. This is what I know about what your body needs just to lay on the couch. This is what I know about what your body needs if it's going to be trying to heal something. If it's going to be trying to heal something specific, it's going to need this and it's not going to need that, like to just say, just cut it to bare bones, get somebody going,
Mm-hmm.
and then dropping those seeds of education along the way. You
Right.
don't have to, it's not like you have to go to med school or because let me tell you,
Mm-hmm.
med school, nursing school, we are not taught all about nutrition. And the nutritionists or the dietitians, they deal with things like a lot of times it's mainly about the tube feeding for patients, or if they're trying to put a patient on a weight loss program in the hospital for whatever reason, then they've got it's like just cut calories, just cut the
Mm-hmm.
calories. They're not even so much, I can't tell you how many times I saw a diabetic get served spaghetti with white
Yes.
noodles and a roll. And I'm like, and the sugary tomato sauce that was I'm like, but it hit the kilocalories, it hit
Yep.
them,
Yep.
and it's like no. So just saying, here's the simple basis. This
Mm-hmm.
is where we'll start.
Mm-hmm.
We'll move on, and then as you have questions and as you have the capacity to hang on to the answers, then we will dive a little deeper into it.
Yeah, no, it's true. And like I have people that they just got done with like their colonoscopy and the food in the hospital is a Diet Coke and a sugar-free Jello. Like, okay, that's going to help the intestinal wall. That's going to aid in healing. So yeah, we're really taught that nutrition has nothing to do with healing. Like if you go to the top cancer centers in Florida, while you're waiting for your scans and your treatment, the only food you can buy is pretty much food that creates cell mutation and can lead to cancer or some kind of chronic disease. So you're exactly right on what you're saying on like as far as how most of us are not taught to connect the two. And that's what kind of forced me down this path is when I was a master personal trainer and I had hundreds of clients. There are people that either came to me that already been to multiple registered dietitians and it wasn't working. I had RDs as my clients that couldn't figure out how to manage their diabetes or lose weight. And then for me, because in like the personal training world and in the nursing world, you're supposed to refer out to scope of practice. So I was supposed to refer out to an RD for someone that needed like a customized nutrition plan. Well, in our area, especially at the time, more rural, the only RDs that were here were only working for the hospitals as admins, like creating the menu for like the cafeteria or for patients. And exactly what you said, like I worked with a ranch here for children and girls that were working on like mental health. When I met with them, the calendar that was created for nutrition by the RD, it said take a chicken breast, roll it in mayonnaise, and then dip it in crushed Doritos and bake it and eat it. So now the chicken breast was great, but to get the calories, the fat, and the carbs up, they had them crush the Doritos, roll it in there because that would give the carb count and the fat count. But you just literally took somebody that could be having severe mental health issues and now just fed them food dyes and MSG, which we know causes people like headaches, anxiety, nerve pain. So we just took something healthy, made it unhealthy because our teaching says we just have to hit the calories, we just have to hit the macros, but it's not actually utilizing science, biology that says you take in nutrients for cell renewal. You don't take in food additives, chemicals, pesticides, and anti-nutrients for cellular function. You take in nutrients. So that's where I had to get this message out of my head because again, and if I need an RD, I call on them for what I would utilize them for. But to teach people basic science about their body and make it where it's not overwhelming, it's really just a gift because now again, they're empowered, just like knowing that their car needs unleaded fuel versus diesel, and they're not going to make unintentional mistakes that nobody taught them about.
Mhm. Yeah, what you said about empowerment, that really struck a chord for me because that is something that I've always wanted to do. That's why I got into helping people with health and fitness. Sorry to anybody that I may have misdirected in that, but when you know better, you do better.
Yes,
And,
exactly.
and that's where I'm at now. But yeah, the empowerment, right? So let's get in our own driver's seat, you know,
Hmm.
like and find those that can actually help us get there. Like
Hmm.
we are supposed to be the ones that are captain of our own ship, you know?
Hmm.
And that's not just like in your career or your family. Like that's in how are am I taking care of my vessel, you know?
Right.
And if someone else, if you're just constantly, I think we're probably just too busy in general. And when I help people, I'm not trying to just tell them what to do because it's what I think is best for
Right.
them. To
Exactly.
me, it's about talking to them about, you know, like I remember when you would ask me, like, does that make sense to you? Does that, you know, resonate with you? Because even if you know that it's what someone needs, if there's no buy-in and if they aren't getting then it's not going to stick, it's not going to work.
Yeah.
You're just putting more info on top of the other info they had, and you're just another voice in their head that they think they're supposed to listen to. So it's really about saying, you know, you've got to take ownership. That's why, you know, like when I was thinking about like what kind of disclaimer am I supposed to say, you know, as a registered nurse, like I'm not guaranteeing healing. I'm not going to heal anybody. You know, I'm not diagnosing anyone. I'm not telling anyone what to do. I'm just talking about common sense things that
Hmm.
are the basis of health. And it's up to you as the client. It's up to you as your own person to
Yes.
actually take that and do it yourself. Own it yourself.
Yeah, they're mostly healing. Right. You're just guiding them on where to look. Again, like a mechanic telling you like what maintenance you need to do on your car to prevent the engine from blowing. We're just giving details and then they're organizing their own life. But I like how you said that some of the course was about selfishness. That's what happened with me is when I was dealing with my most chronic ailments and I had all these specialists and no one could figure it out. I had to start looking somewhere else. And I got a little bit scammed by one alternative health person that, sold me like $400 in supplements every month, like through applied kinesiology muscle testing. They thought they were doing the right thing, but it wasn't the right thing. So I was just as disenfranchised with conventional medicine as I was with like holistic medicine because it was like one went too far right, one went too far left. There was too much tests and supplements and not really, again, asking me about my life. So when I started learning there was other courses I could take, I started studying under all these specialists around the world. And, like one person I learned about, I was attending with a client at like this Agaski posture therapy course. And he was paying for 10 sessions at a time, like $1,000. I'm like, well, wait a minute, I can just pay 800 of the course. Now I'll know this for the rest of my life. Even if I don't use it, I'll know it. And even if I still need a few sessions for myself, me investing in the course reduces my need for that other practitioner. So my ER bills at the time, I had 2 ER visits, $2,500 each on my part, my deductible. So $5,000. And my insurance that year for self-employed person was $6,000. So I invested $11,000 that year into my health with zero answers. I was having neuropathy, chest pain, bradycardia, the anemia, swollen lymph nodes, no answers for that $11,000. So I said, okay, I'm going to start investing this money into these specialists, these specialty courses like certifications. If I never use it professionally, if I at least know for me and my family, it's going to be an awesome return. So like I took a Gasping posture therapy and then that led me to other natural people. And then I took like, Paul Chek's courses and holistic health. But what I noticed is almost every person still felt like this one thing fixed everything, or the ego was getting involved, like it's only this. And for me, I was like, okay, that's not good either. So what I did from all those specialists is take the best of the best, like what worked the most efficient, and then also had to take my own self-study on the cells, the cellular nutrition, because that wasn't anywhere. People always ask me what book, what course, what college degree. It does not exist. I wish it did because it'd make my life easier. That's why I'm working on the Healing with Excellence book and the neuromuscular restoration book. Because even my colleagues that teach manual muscle testing or like neurocorrection, they don't correlate most of them on the self-care and the nutrition, and that you need certain foods for your nervous system to work correctly. So anyway, where I'm going with this is when I started investing in my own personal education for me, I healed myself and none of that money went to waste. Now I have knowledge that is never going to leave. So I tell people, if you just take the practitioner course, it's online. You can watch it as many times as you want. And then if you attend the pre-recorded course, but you still want live, forever, when I host a live course, you can attend for free because it's on Zoom. I can have multiple people at one time. And so why not have this knowledge that, like, I mean, many people that have attended have told me, Kim, you prevented like 4 ER visits from our family just this year by what you taught me. So how did you feel? It wasn't in a normal college classroom. It was completely done online through Zoom. What did you feel about still getting the education online versus in person?
Well, I did both. So I have experience from both. I did the neuromuscular in the
Mm-hmm.
live course, and I did the virtual for the practitioner course. I really love the interaction with the other students
Mm-hmm.
and the other backgrounds. It was really great to see many different backgrounds of folks in there. And the questions were great. The information as it was presented was very simple. It was easy to digest.
Mm-hmm.
The printouts, having something printed out to, refer back to, take notes on. One, you probably remember, I was like, what about the paperwork? Like, how do I was all worried
Yeah.
about like, the logistics of everything, and having that template and
Uh-huh.
then having the explanation as to why the template, the questionnaire, why it was organized the way it was. I was
Yeah.
like, oh, this is magic.
Well, do you remember Myra said, Kim, you know what I realized? You're not even that brilliant. It's just you put it together in the right order. I'm like, actually, Myra, that's true. That's why the health paperwork is that way, because it reduces your likelihood of missing anything. And when you go over that over and over with yourself or a client, you submit it to memory and it becomes your common knowledge, these deficiencies and like which puzzle piece to put in together. So no, I agree with you. And for me, I've taught both courses live and I've taught them both online. People love both. What they love about the online is it's recorded so they can always go back and watch it because, as you know, it's a lot of information. When I only did the practitioner program live, people loved it in person, but then they go home and be like, what did she say again? And their notes, they took the note, but it was a little bit off. Well, there was no recording to go back to. So they'd see some recap from me, but different. So one of my other colleagues teaches a cancer prevention course, and I'm like, let me attend his course to see how it is in Zoom. And it was really awesome, like you said, to be with all different types of practitioners and people. Like in your course and other courses, there's been bankers, housewives, personal trainers, nurses, PTs, other medical professionals, and from all walks of life, but we're all still human and we all still have cells that need to regenerate. So we need to know these basic foundational pieces that are being missed. So the people love live, but they've also loved the recordings going back to it any time. So for me, the people that are even attending the neuromuscular restoration online, they're being able to attend it at their own pace. And then when I have study groups or when they come to the future live courses, they already feel like they have an awesome foundation. And none of their money is going to waste like mine did. Like everything is a lifetime of knowledge that nobody can take from them. Like that's what I love is nobody can take from me what I know now, and I'm completely empowered. And I've literally had one doctor's visit now in like 14 years since learning this, and I have stacks of medical records from like 13 to 33. And so to be able to be that empowered, to be in charge of my own health and no ER visits, I mean, it's profound.
Yeah, it's definitely the having the coursework to refer back to. It's funny because I was thinking about the neuromuscular course and how I was like, man, I wish that I like after that course, I was like, I wish I had the demonstrations or something to refer back to. But then when we did those videos
Yeah.
that we posted on Facebook with the demonstration, I've referred back to those
Yeah.
several times, as I was, getting more used to doing those myself. And even like to show people. Like sometimes I'm so visual. I'm a visual and a kinesthetic learner.
Yes.
So having that visual instead of just relying on an audio or just relying on something in a textbook or on a piece of paper, notes, some things like I'm a pretty decent note taker, but even when I refer back to notes, sometimes I'm just like, I
Yeah.
have no idea. No idea. I'm sure it made sense at the time, but now it's gone.
Yeah, that's definitely me.
Yeah.
So with the Healing with Excellence practitioner, I tell people if you really want to sit with people and be like a consultant and health advocate, that's the route to go.
Mhm.
No, no, the neuromuscular restoration practitioner or specialist, that is, as a practitioner, you're more hands-on, you're testing, like you're using regular like Kendall and Kendall muscle testing that a physical therapist might learn, and you're testing muscles to see how they're communicating with the brain, and you're finding other muscles that could be compensating. You're using a specific protocol. And then if you've been trained in the Healing with Excellence practitioner program, you're combining those two things together to accelerate the muscle correction. Because if you can look at the whole picture, the muscle correction might take 2 or 3 visits versus 30 visits. I mean, some people might have to go to 2 or 3 rounds of PT and still not heal. And most of the times with the neuromuscular restoration, I mean, I've had people heal pelvic floor pain in under 3 visits that they might have had for 20 years. But in your situation, as we talked about in the other podcast, we had to correct the neuromuscular dysfunction, but we also had to regenerate tissue that had wasted. So if someone has had wasting in tissue, that is where we use the Healing with Excellence practitioner program to regenerate. But if they just had an acute injury, like a military professional or a soccer player that just sprained their ankle, we can do a muscle test within 2 visits. It's typically better. Or if, again, somebody got a muscle problem because of a UTI or the muscle problem caused a UTI, typically it's 1 to 3 sessions and it's done. It only the chronic issues might take a little bit longer. But like the neuromuscular restoration we talked about, we were talking about the ER visits for like the heart palpitations, the dizziness, the vertebral like intermittent occlusions. Like, do you remember things in the hospital that you felt like you couldn't answer and people went home, and then when you took neuromuscular restoration, like, wait a minute, there was actually answers to all of this?
Yeah, TIAs, the transischemic attacks, the mini strokes.
Mm-hmm.
That was something that came to me. That was one of the biggest frustrations. That and chest pain is another one.
Mm-hmm.
Um, patients come in, they have these symptoms. We run all these tests, no definitive answers,
Mm-hmm.
and we spitball it. We
Mm-hmm.
guess,
Yeah.
okay? An educated guess. Again, I'm not calling anyone stupid,
Right.
okay?
You're
But
just honest.
we all know it. We don't know what it is, and we tell the patient, it must have been this because there has to be a diagnosis code, right?
Right.
Why?
Right.
Got to get paid, right? So there's
Yeah.
got to be a diagnosis code. So you find one that fits as best as you can.
Mm-hmm.
And so TIA, was it like you must have had a mini stroke. Oh, honey, I must have had I hear patients talk. I just must have had a mini stroke and that's it. And they don't know.
No.
And then when I was taking neuromuscular restoration and I'm like, wait a minute, wait a minute, wait a minute. So
Mm-hmm.
you're telling me this could have just been because of a tight neck muscle?
Yes. Yeah. I know it's
That's
crazy.
it?
Yeah, and that the vertebral occlusion, the arterial occlusion can cause like 20 to 30% of strokes per year just by a muscle intermittently cutting off the blood flow. And so the two most misdiagnosed things that I see coming from either the ER or from like a cardiovascular or a GI doctor are vertebral basilar issues where the artery is being temporarily occluded by a muscle that's intermittently contracting too much. Some people call it, like, there's another version called bow hunter syndrome. Like a bow hunter does this, well, then their scalenes start to get too tight and impact either the internal jugular vein or the carotid artery. So because imaging at the ER is done static, like just a CT or MRI, they're not catching that the muscle is contracted. Like some people will use like a transcranial Doppler ultrasound to try to see like movement where it's occluded. But again, like only one hospital in a 100-mile radius has that tool here, and they hardly ever use it in the ER. Because I have many professionals that work for HCA. One professional, I needed to send her for this, so I had to find out which hospital it was at. But as a whole, the other thing that when it happens, Most physicians only believe you have to cut the muscle. And you guys learned in class, you just have to find out what muscle it's compensating for. So let's say the right glute isn't effectively working, like the body's not communicating effectively to the glute and it's sending too much information to the left neck. The neck will be tightening too much and impacting the artery or impacting the phrenic nerve. And as soon as you make that correction, sometimes within one visit, like the blood pressure normalizes, the heart rate normalizes, the diaphragm relaxes, the chest tightness goes away. I literally had a 30-year-old that had a stroke. Now, again, I've only met two people my entire career that pushed through the warning signs where the muscle tightened so much that it caused a stroke. Most people, it's dizziness, vomiting, lightheaded, blood pressure changes, little signs that they get warning and they slow down. But this young lady is driven at work. She kept ignoring this tightness in her neck, had a stroke, was at the ER. Beautiful, fit girl, perfect blood work. She had 5 specialists said, we don't know what caused your stroke. She's like, Kim, do you know what it's like to have 5 specialists over you in the hospital and they don't know what caused my stroke? I have no idea what to do. She worked with a gentleman at a large company, and he said, there's this girl that helped me with my pelvic floor pain. I think she might be able to help you. Her and I met, and literally it was just like in like the suboccipital area, her left neck was compensating for other muscles. That's where the stroke happened, in the left posterior area. And we fixed that. And now she's getting back to normal life. Like, she was having MS symptoms, all these, and it was literally like her diet, some stress, and the neck muscle issue. So that's one of the most common things I see misdiagnosed. And then the second thing I wanted to share with you, and then we'll get more back into like your aha moments, is GI dysfunction. So many people, again, might have vomiting, gastroparesis, constipation, chronic GI pain, and they've taken Miralax. And this could be a 2-year-old up to 92-year-old. And if they've been everywhere and there's no answers, and even if they haven't been everywhere and there's no answers, I can do a muscle assessment. And 99% of the time, there is a problem, like in the paraspinals around like T5 to T8 in the thoracic spine, where one muscle is overworking there for like their lumbar muscles, their glutes. Something happened that tightened that area, and the muscle is compressing the nerve, and the nerve cannot signal correctly to the digestive tract. And so they start getting all this weird dysfunction. And no matter what they do, it doesn't work. Again, I've never had anybody in my entire career that took more than 2 sessions to correct that. And I shouldn't say that. There's a very small percentage, again, like less than 0.5%, that if it keeps reoccurring, and we haven't talked about food, sometimes they're consuming too many pesticides in their diet, like glyphosate and oatmeal, or like Nature's Own bread. The pesticide is causing the diaphragm to lock and then compressing the thoracic, causing these muscles to be reactive, like through a visceral somatic relationship. So sometimes we've got to be a little bit more aware on the diet. But a lot of times, like one girl just came down on like a bouncy house thing, raked her back a little bit, and that muscle just went into overdrive and nobody knew to check it. So we just do a quick muscle test. We teach them how to release the paraspinal area, get the muscle working that wasn't working. Again, like it's a 2-minute corrective exercise, like 3 times a day. And then all of a sudden, gastroparesis is gone, vomiting is gone. And it can, again, when I share this, it can sound too good to be true. But what has been your experience since learning the neuromuscular restoration in reference to that?
It makes perfect sense.
Mhm.
It even like from a medical standpoint,
Right,
it
right.
makes perfect sense when a nerve is impinged and it can't send the signal, just like your analogy that you share with us about the house and the breaker. And if you turn a switch and the light comes on in a different area of the house, okay, we have electricity. Okay,
Yeah.
it's
Yeah,
okay. We got electricity. We just got some wires that got crossed. We
exactly.
check where it's crossed. We tell them, okay, nope, you go here and you signal this, and you go back over here and mind your business and you signal over here. And so once it's one of those things like I never was able to see them, but those 3D pictures, those images where if you look at them, they look like a bunch of dots or something. But if you look at it long enough,
Yes, it
and you
becomes something.
focus just right, it pops out at you, and
Right.
then you always see it, right? That's what this is to me. It's my
Mhm.
3D image. Once you look at it, it cannot be unseen. So
Right.
once you started talking about, oh, well, basically it took what I knew about the nervous system and the organs and all of the multi systems, and it put them together. And it said, instead of siloing them and
Yes.
having GI look at GI and cardiac look at cardiac and pulmonary look at the lung, instead of siloing,
Right.
what if we looked at how all these systems are talking to one another or not talking to one another appropriately, and we figure out, oh, that switch.
Mhm.
It's not like I think you are smart. Like I know Myra's joking, but
Yeah,
yeah,
yeah.
I know she was messing, but like
Peaceful, but I know.
it's about putting them all together.
Yes.
It's not that wild or bizarre when you
No.
actually look at it like, oh, a nerve's pinched. Oh, that makes sense. That
Yeah.
makes perfect sense. It's
It's
just because we don't know what we
right.
don't know about this amazing, fantastic body of ours. But
Exactly.
once we learn, like you said, these courses, like once you learn
Yeah.
and you have the reference material to put all the pieces together,
Right.
then it's like, okay, I know that's one reason I was told I was such an amazing resource, and people, they were constantly having me be a preceptor. It wasn't that I know everything,
Yeah.
although some people would accuse me of thinking that,
You
but
know you do. Yeah.
it's that I know where to find the answer. And
Exactly.
that's what these courses do. Is it says, okay, here's where you can find the answer. You don't have to know everything. You
Exactly.
just got to know where to look.
You're so true. Years ago, I trained a radiologist, and that when I was first getting into college, I either wanted to be a radiologist because I wanted to know everything, or I wanted to be a dietitian because I had a body image distortion. I wanted to have the best body to be treated better. So I went the dietetic route. And later on, when I was training the radiologist, I asked her, "How do you know everything?" Because like I wanted to know every pathology. I said, "How do you remember?" She goes, "Kim, I don't remember it all." She goes, "I Google it." But in school, it taught me where to look. So I know the terminology, and that's it. Teaching someone where to look. And I tell people about neuromuscular restoration. It's kind of like we're an electrician for the body. We had a breaker go out and I didn't know which one it was. So electrician came, they put their little thing on each breaker to see which one was not getting energy, and they knew exactly which one to replace. All we're doing as neuromuscular specialists is going through and seeing which breakers flipped. Like, is it in the neck? Is it an eye muscle? Is it the jaw? When we find, or is it 3 or 4 breakers that are flipped? Because it can be. So once we find the like 1 or 2 corresponding patterns and we just flip the breakers back over, the voila, the electricity goes everywhere it should. And then all of a sudden the person's fixed. And like, that's one thing I love about neuromuscular restoration is it can gain instant buy-in for faith and hope. Like some of you know that a client like in back in 2014 that was diagnosed with ALS, Lou Gehrig's disease. He was 42 years old, had a family of 3, was basically told there's nothing he can do. He's going to be gone in the next 2 to 3 years. And somebody knew me and said, "Hey, Kim, do you have any organic food he can buy?" And I said, "Hey, can I donate my time to this person? I want to talk to him," because I felt there was other answers. And when we met, and I did a neuromuscular assessment, and like his glute wasn't working right and his legs were twitching. And then I flipped some switches and all of a sudden things were working. He's like, "Wait a minute, you mean I don't have permanent wasting? I don't have permanent nerve damage? Like this can come back?" And I'm like, "Well, I can't make any promises, but because nobody has looked at your stress, your mental health, your diet, and your neuromuscular dysfunction and your diaphragm and your neck, there is a chance because they haven't even looked at basic science. They're just giving you a label and telling you like live out your best life till you're gone." Like his wife asked, "Is there anything they can do nutritional?" And like, "No, let him drink, do what he wants." He could cook like amazing, but because of depression with the diagnosis, he was like up till 2 a.m. and just drinking alcohol, eating less than 1,000 calories a day. And I'm like, dude, if I was doing this, I would have all of your same symptoms without a diagnosis. So literally, when you do neuromuscular restoration and you can show someone with MS that they can get dorsiflexion back, or that their foot drop can go away by flipping 2 breakers over, they instantly have hope and they'll instantly have some level of trust or some faith that maybe this can heal. Maybe I was not taught where to look. So what I love about neuromuscular restoration, you can be a personal trainer that just wants to help your athlete run faster. Like we had an Olympic gentleman that was going out for the Olympics, and he was an awesome sprinter. He didn't know one of his glutes weren't firing correctly. In one correction, he shaved 2 seconds off of his sprint. For an Olympic athlete or someone aspiring to be that, 2 seconds in 15 minutes is a huge deal. So you can either use this to help like athletes on the field, or you can help people with chronic disease reduce their symptoms, often by at least 50%, and sometimes completely. I just don't like to plant like false hope or, anything that would lead somebody to different faith. But I'm telling you, like it's been over a 90% success rate in every single session I've ever dealt with.
And sometimes it doesn't even have to be 100% complete resolution for
No.
you to have such an improvement in your life that, like, I mean, we are all aging. I mean, some of
Yeah.
us faster than others because of, our environments and stuff like that. But like, even if it's something, and I got permission. My husband's like, yeah, tell my story.
Yeah.
But
Woo.
this is another aspect of learning for yourself, and it helps your family. It has an overspill, right? And so my husband had been having issues with his eyes. Some of it's just normal process of aging that is going to happen, but he was having trouble with one of his eyes, and I was like, we need to go see Kim. But again, we're all on our same path. This is something
Yeah.
that I'm working on. So he made some calls. I was like, look, I don't care what you do, but you need to do something, because I don't know. I think you're just going to go blind in your eye. And I don't
Mhm.
want that. And I could see him suffering. So he made a couple phone calls. He called ophthalmologists. They're like, you've got a detached retina. And I'm like, I don't think he has a detached retina. If I'd have thought that, then we would have taken him somewhere immediately to get
Right.
that looked at.
Right.
But then he's like, so about Kim, and I was like, yeah, okay. And because for me with him, and
Yeah.
you and I've talked about that, like checking him,
Yeah.
it's harder for me. And we're very connected, as our most recent neuromuscular checks
Yeah.
showed some of the same symptoms. But he, in the one visit that we hadn't checked the first visit. We hadn't checked his eyesight, on the little chart. But after the second visit, he was like, man, we should have looked at that. And so you're like, well, let's look now. And he had a change in just that visit.
Yeah.
And he's like, and it's not 100%, but just in that one showing of improvement.
Right.
I know that's why he's doing the correctives,
Yeah. Yeah.
and we found the one supplement. He's taking the one supplement. So, when you're talking about, complete resolution, no, it's not about guarantees, but to me, it is about hope, and it is about saying, well, I mean, how's the other working out for you? Like
Yeah, if you're
the
getting no
docs,
resolution, or
yeah.
like some people are just getting injections in their eyes and the muscles aren't being addressed, or so no, even if it's a 50% improvement, some quality of life, or it doesn't digress further and you stop it, that's huge. And that is why I had to get an eye chart in my office, because again, I had people that out of the blue, double vision, go to their eye doctor. One person spent $1,000, no answers. His wife's like, maybe go to Kim. Why is it always the wives? But anyway, so she refers him to me, and it literally, this young man, because it was very cute, and he was like, I think 30. It took one session, double vision was gone. And it was so awesome to see that on a chart. I've had 80-year-olds improve like 2 or 3 lines right after the correction, just because now the muscles and the optic nerve can communicate correctly. Because a lot of people don't realize there's muscles around the eyes and in the upper neck that impact your vision. And so, like you said, like I think he improved by 3 lines after that visit, your husband. And so that gave him some instant buy-in, like, okay, because again, as you know, with what we do, and I expect this, there's skepticism. Is this quackery? Is she just playing tricks on me? So when you can show a fact-based person that has only went conventional, instant kind of feedback that can show them that, yeah, this is true data, this is real evidence-based outcomes, you're really feeling this change, that it says, okay, maybe there is hope for me. And maybe if I do treat my body a little bit better, I can see a better outcome and reduce the decline. And that's what I tell all of you. I don't think neuromuscular restoration fixes everything. And I do believe it helps get the body back to homeostasis. But what I love about it the most is that when you give somebody some kind of feedback that their body is that brilliant, you gain their buy-in for them to start treating their body just a little bit better and have hope that the natural aging process hasn't just taken them out and that there's nothing they can do to slow that process. You know?
Yeah. It makes them more willing to take ownership, like we were talking about. Like it's like,
Yeah,
oh, actually I can.
yeah, they're involved in their own healing. And that for me, I didn't know where my liver was and my small intestine, that there was muscles around my eyes. So when I started learning like how freaking amazing the body is and that there's trillions of cells compressed together to make all these organs work every single day. And I'm like, oh, I won't eat for 10 hours. I won't sleep. I'll just live off coffee and a granola bar. Or I'll eat a muscle milk shake and not eat anything else, whatever it is. Once I started having that level of respect for how awesome the body is and how it can actually heal and regenerate and reverse all those symptoms through this approach, it was drastic for me. And that's why I tell people, if you can get the neuromuscular restoration and healing with excellence practitioner, even if you don't feel like one of them is your gift, you're just exposed to it. And even if it took you 5 years to kind of thumb through, like, 15 days of work or something, you know where the knowledge is at. You know where you can go there. And then I'm your mentor, so you can ask me questions anytime. And like what you said, it's very hard to work directly on our family. I do have people that have been able to help their teens really quickly or check their husband. But if it's a more chronic issue, our family doesn't want to listen to us. Like, I'll hire you for my daughter, you hire me for your husband or your son. And so we might still work together as a team, helping our families. But knowing where to look from those two things, again, I would say 90% of my client base heals from those two approaches. And as you know, for your healing process, we did the neuromuscular assessment, then we went through the health history, we went through vitamin deficiencies, hormonal imbalances, lifestyle stressors, and we put those puzzle pieces together. And now you're doing this to help other people heal.
Mm-hmm. Yeah.
To me,
Yeah.
it's huge. Yeah.
It's amazing. I love it. There was one thing I was thinking about the it'll come to me later.
Yeah,
I'll
good. Now, the only other thing I want to touch on, because some people, because it's not a designated license or it's not a degree, they might feel like, okay, who's going to respect me? Or do I need to go get the degree first and then do this? For me, like I was like, do I go back to med school so I can have this credibility? But then why would I spend 10 years in med school to learn half the things that don't work and then have all of that debt? And then again, I went to multiple doctors that couldn't heal me. So why would I want to be a doctor? I want to be a neuromuscular restoration specialist because the doctor didn't work. I want to be a healing with excellence practitioner that's just holding your hand, taking all of the specialist data and being the missing link to help walk you through, like being your advocate, not negating the cardiologist, the hematologist, the GI doctor, looking at the data they found, looking at your blood work, and then helping to say, okay, what pieces did they miss? And how does this link with this? So that way all the electricity comes back on and the cells can do what they want. Like, do you feel like the courses themselves were just as valuable to your life as like getting your RN degree? Or do you feel like the investment was a waste in some way?
no waste whatsoever. Probably even more valuable than, and I don't know exactly. I mean, probably I spent 40 or 50 grand on my nursing degree. Um, and not to mention whatever I've spent during my career on different things. But no, this course has not been a waste. It's the opposite of a waste. This is very valuable information that is empowering. And basically, as a nurse, I was frustrated because I was not helping people find answers. I felt that I was putting band-aids on things, patching people up the best that I could, and then sending them home worried about them. And that's a lot of weight for one person to have. If you think about all the patients that I was seeing
Yeah.
day after day after day, year after year, and to be worried and concerned about their well-being and knowing that when they go home, they're just going to go right back to what was causing them to have these issues and not fixing and not, it's very, I am working through a lot of guilt, feeling like, you know, man, I could have helped them, with this information, or, like, but again, when you know better, you do better. I couldn't do anything without what I know now.
Right.
But I appreciate myself for continuing to seek,
Yeah.
because now I don't feel that same frustration. I feel like I actually can say something and it means something. It helps point someone in a direction that is actually towards their own healing. It's actually, instead of being like, well, here's some meds and I hope you get better, and then as soon as they leave, it's like, we'll see them next month. Like, because that's the thing. We
Right.
see people over and
Right.
over and over. It's very rare in what I did to not see someone. Some people go longer between needing to be hospitalized, but yeah, the value to me for myself, my family, and those around me that have the ear to hear or are ready, and are seeking like me,
Mhm.
it's immeasurable to me.
Mhm.
The value that I have found in these courses. And I know that sounds like an infomercial or something, but from like, it's very stark, the difference of how I feel when I support and assist someone in digging and figuring out where's the root of this issue. It's very different to be digging in that way than following policy procedures and doing just based on the protocols, and then, calling it a day and getting back up to do it all over again. It's stark difference.
Okay. Yeah, no, and what's so hard for some people to believe. So for some people, because the two courses right now combined are $2,900 as a special. Now, again, this stuff it could really be like a PhD program. It could be like worth 50 grand. I mean, again, the money that I invested prior to learning this, I mean, it's literally in the tens of thousands, probably almost $100,000. And I lost a lot of my quality of life. So a lot of people think, really, Kim, for like less than $3,000, I'm going to learn all this. So some people think it's high. Some people think it's too low, so they don't have perceived value. But for me, that's where I was called to put it around $2,900. And again, it could be like, oh, really? Like, because it's a total of like, I'd say around 15 days of education. So people are like, oh, in 15 days, I'm going to know more than this. But people don't realize, like, there's no way, even if you sit through 2 years of nursing school, that you're going to retain everything and know everything. You have to put it in practice to become the expert. So what I do is in the two courses, I give you the core where you need to look and how to walk people through the foundation. And then as you start practicing, you get better, you get better questions, and then I can give more information, or the small continuing education courses. The main goal is to get you the real meat and potatoes to, that's a big thing for us, to where like the cliff notes that are most important. So you don't have to wait 10 years to know how to heal somebody. That's the only thing. Like I love and appreciate all the mentors I've had. But some of my disappointment has been because of capitalism and because of how some people learn too. There's these levels like level 1, 2, and 3, but you got to wait to 3 to get like a critical piece. But some people won't go to level 3 because they don't feel secure enough in level 1 or level 2. So it might take them 6 years before they go to level 3. And somebody they're helping, like someone with the ALS or Lou Gehrig's, they might not have known that, wait, you need to look at the eye muscle or the diaphragm because it was left to level 3. And for me, what I like to do is give you like the highest level stuff first, but make it feel attainable and easy to implement. And then as you start practicing, you're like, wait a minute, I forgot what she said. Or Kim, there's this weird situation. Then I can fill in the gaps. So I don't need to charge you $50,000 up front or drag you on for 10 years so that I get a continual stream of students always with me. To me, people ask me, like, how do you make money if you help people heal in a couple sessions? Now, again, some people take 20 sessions. A lot of people take 2 or 3. I said, well, for me, if that one person heals and they refer 10 people, if I have 40 different people in a week that are all healing and they refer 40 more, I'm always working 40 hours a week with a full paycheck, but I'm not seeing the same person 40 times, going home depressed at night that person's not healing. And so for me, it's the same way with my colleagues or students. I don't want them to take 10 years to have what's in my head just so I have a steady stream of money. Those colleagues and students are going to refer other people, or they're going to have a family member or a client that feels over their head and they're going to give me a session. So I can be successful, financially enriching the world by helping people learn this faster versus waiting for them to get the info. And again, if I make you implement like a level 1, but I'm giving like leaving out pieces, you're going to feel so, because you already know it's insecure at first sometimes when you're doing the muscle testing, because it takes time to learn that. If I leave out bigger pieces, the new people are going to feel even more incompetent or insecure because they didn't know where to look for other muscles. And so for me, I'm going to give the whole kit and caboodle to look at, like, here's a foundation where you look. And then as you start practicing making mistakes, asking questions, then I can help you with how the brain really learns and how the body learns. You can't even retain everything in one course or 2 years of college or 10 years of college until you run across these stories. Do you agree with that?
100%. Yes. And what you were saying about like when people, when you're not actually feeling like you're helping people, like it's a bait and switch thing.
Mm-hmm.
Like,
Right,
oh, here's just enough to keep you coming back to me. You keeping on coming back to me. We've already got that system.
right, right.
Okay. We don't need another one of those.
Yeah.
That can already be found somewhere else. When
Mhm.
you actually help somebody and then you don't see them again, or you only see somebody come in because they were referred, which is how I met you.
Mhm.
Someone's grandmother had a great experience with you.
Yeah, yeah.
And she was like, oh, yeah, go see her. And she didn't know you. She
Yeah, I've
just
never
knew how
met
much,
her.
yeah,
Yeah.
how much her grandmother loved you and what you had helped her with. So that to me is more fulfilling for my life. And I'm not judging anybody else for
Right.
what fulfills them in theirs. But for me, I've had the other, and it
Yeah.
doesn't feel good. And I don't sleep well at night, and it took its toll on my body. And that is something that I want to tell your listeners, our listeners, is that it's what I was thinking of earlier, and I couldn't remember. It came to me. It's not that I remember thinking that why is my body betraying me? And I had this voice, just it came to me clear as a bell. Maybe it was my body, maybe it was God, the universe, whatever. But I heard distinctly, I didn't betray you, I saved you. I'm
Mhm.
not trying to betray you, I'm trying to save you.
Yeah.
So the courses show you that, like the information that you learn that these signals, the pain, the symptoms, it's not your body's betrayal.
Right.
it, it's saving you. It's saying, hey, like you've mentioned before, our body only has certain ways it can communicate with us. So once you learn what those signals mean,
Mm-hmm.
then you can effectively answer them and then keep on improving your life and then the lives of others by default. Like it's definitely about the synergy within humanity, to go big with it. The people that are watching you and saying, oh, she just left. Like, what happened to her? Oh, she was sick. Oh, but now she's like doing great. Oh,
Yeah.
go see her. Like the whole process of how it works. That that to me is priceless. Like you said, whether it's just to help you, just to
Right.
help your family, because I've also helped my son.
Mm-hmm.
Um, like I've brought him to you, but I've also helped him a couple times with pain in his jaw just by doing the neuromuscular check. He gets up from the table and he's like, oh, huh, thanks,
Yeah.
mom. And I'm like, dude, it does work. That's so cool.
Yeah. Yeah.
Even if it's for just that,
Yeah.
or if it's more than likely going to actually affect more people than you think it will.
Yeah, no, I agree with you in that it's just awesome to be empowered with that. And I tell people, like, one class in a college semester is typically at least 3 grand. So this is the cost of just one of like a 3 credit hour class or less. And then you learn it. It's like an accelerated learning with a continual growth process. So I tell people, like, for me, it has been a continual return on investment. But for me, I did have to invest tens of thousands of dollars in 20 years of discovery to be able to learn how to condense it to where I'm at. So it's basically people paying for my efficiency and for the work I've already and the suffering I went through and my, thousands of clients that I've worked through to gain this experience. But again, my goal is not to make it unattainable. My goal is to make it where everybody has access to this, and wherever they want to go with it professionally or personally, that's up to them. I just have to figure out how to get the word out, because for me personally, there's a girl that her healing story is going to come out soon, and it's absolutely profound. She was at a local hospital, basically in the dying process. She has 3 really high level medical professionals in her family. For 20 years, she's been dealing with a GI issue that they gave her prednisone to treat it. Well, in her 30s, she tried to come off the prednisone because it caused every vertebrae in her spine to fracture in her 30s. So when she tried to come off the prednisone, she went into adrenal crisis, was hospitalized, and they didn't know what to do. So at our local hospital, she was there about 15 days, and then they were giving her forced discharge home because they had no options. I knew, like, I had at least 25 people reach out. Can you please help this woman? So I ended up calling a family member and say, look, I don't normally do this, especially on a Sunday, but your family member needs help. And if she doesn't get another approach, she's not going to make it. Like, she's going to be dying. And, that's a really profound thing to say to someone that you've never met that is in the medical profession. And so I asked, can I come by the hospital? I went to visit her, and in under 30 minutes, maybe 15, I found exactly where the root cause was 20 years ago. It literally took 30 minutes to find the spot in her mid-spine that was working for something else that was causing the GI issue. And because the GI issue is addressed with prednisone and multiple other things over the years, and not the neuromuscular system or the diet or the mental stress, she just kept wasting and having reoccurring issues. So we could fix the root cause immediately, but there was so much damage internal to the tissue that she's been pretty much healing on bed rest for about 12 weeks. But if you see this girl today compared to where she is kind of like, she was swollen like a blowfish. And this girl started like 110 pounds and she looked like 200 pounds. Her son's like, Mom, you look like a teenager. Like, you look amazing. And she's reversing the bone loss, the GI. She's on 0 medications now, no prednisone, after 20 plus years of an issue. And she's going to have this huge comeback. So when I did that, I'm like, Kim, you can't hold back. You've got to figure out how to effectively get this word out, because I'm not going to go through this major marketing thing, and maybe in the future, but having the most perfect website and hiring this team and doing this, because when you have been close to the dying process before, you don't want to always be connected to a computer. You don't want to always be connected to how you do your marketing and constantly doing videos and making sure everything looks perfect. Maybe in the future, I'll hire a whole team for that. But as a whole, I just want to be honest and share the information. Whoever is supposed to be drawn to it, they take the courses. Again, maybe in the future, I'll put 30 grand into some marketing campaign, but that's not my goal. But I do need to get the truth out there as close to the truth that I know, and talk to honest people like you and what you've been through, like your story, so that other people can see if it resonates with them.
Absolutely. Yeah, because it's also not about like creating people that are dependent on you. Like this,
Right.
this that you shared with this woman,
Mm-hmm.
it's about her. Then go, here's your life, go get it, and here's how you can, you can do this. And that it's priceless.
Yeah, no one can ever take this away from her now. Until it's her time to really leave, she's going to be pretty empowered. So just to recap, we have the Healing with Excellence Practitioner Program if you're interested in just like consulting people and being their holistic health advocate. If you want to work more with the muscular system, the nervous system, and help, whether it's athletes, neurological support, chronic pain, GI issues, you can learn that, or you can learn them together or separate. I always recommend taking both and being patient with yourself, that you're not going to know how to, like, I've been in this field for 27 years. There's no way you're going to apply it like me right from the start. So be okay to be a beginner. And again, I didn't even know any of this until about 14 years ago. So it took the first half of my career to be led to the second half of my career. So if you can be a subject matter expert in under 5 years, because that's typically, it takes less than 5 years once I show you where to look for you to be an expert, as long as you don't beat yourself up to be perfect. Get this information to have on hand for you, your family, or your future career, whatever your passion is going to be to help serve people. you know?
Yes.
Yeah. Well, I appreciate you. If there's any final words or thoughts that you have that you want to share with them or you want to send later, please feel free to let me know. But I want to share with you guys Jessica's site. I'm going to share it in the show notes. It's Arrow Holistic. It's just Arrow Holistic, right? Is there anything else attached to it? Okay, I'm going to
No.
share that. And you can see her site. It's beautiful because I have been traveling overseas a lot more. And it is impossible for me to literally help everyone, so to speak, or a lot of people at once. Jessica is one of the next best people to go to, especially to dig deeper, like to do the Healing with Excellence practitioner work. So please, like if I'm not available, I really recommend you going to her because with her nursing background, her healing herself, and then having the courses, she's going to walk you through just as passionately as I would. So if I'm not available, she is the next best person out of our team that I would refer to. We have multiple people that are going to be added to the site. And in the future, we're building an international team where we do the intake together. Like we might have a virtual client in Canada that they're on the call with all of us practitioners or as many that can be on the call. And we're going from our different backgrounds. We take in their data, I start the program, and then the team supports them through. So we have different ways in where we're going to serve people as a team and then still as individual professionals utilizing the gift the way in which we were designed to apply it for people. Because not people aren't supposed to be me. We need practitioners and people that have a different calling than me to utilize this knowledge for where their gifts are going to be the best used or the best served. Well, thank you guys for hanging in. It's a little bit longer podcast, but it's deep stuff. We got to share it. And again, it's unedited, completely improv. Whatever comes through us is what you're going to get. So I appreciate you for joining us and thank you for helping us make a difference in the world.
Yes. Thank you.